We at the state, contracting with RTI, have been working on this dashboard for about a year and a half to try to bring county-level data to everyone across the state. It is not the only data that we should be using for our assessment and understanding of our community, but we hope that it provides a little bit of a shortcut for you as you're doing your assessment, and at least is a good starting point for your work and assessment. The way I have this set up today, I do have a PowerPoint for everything, but for most of this webinar, I'm actually going to go over to the dashboard and to walk you through all of its features. Do feel free, of course, as always, to ask questions in the chat box. Terry will be monitoring those and will ensure your questions get answered. So as a quick overview of this presentation, I'll talk a little bit about the purpose and why we wanted to do this. Then the bulk of our session is going to be showing you the features and the various views that you can utilize. We'll talk a little bit about what measures are there, what the limitations are of the data set, what we plan to do in the future, and then give you an additional opportunity to ask questions. But as always, again, I encourage you to ask questions throughout as they occur, and we will address those. So the purpose of the state has several times contracted to provide EPI profiles. In the past, they've always been a hard copy bound book that was static. Once it was done, it was complete. It was much, and we had to disseminate it to everybody in the hard copy format. So people sometimes lost those, and more importantly, the updates couldn't happen very regularly. So we really wanted to be able to do something online that we could be able to use in a multitude of different ways, and most importantly, to be able to update as new administrative data comes along. This was funded by the PFS project, which is a SAMHSA discretionary project, and it was planned with the statewide epidemiological outcomes work group, which we also call the SO, and it was it's being developed by Research Triangle Institute. So now I'm going to share my screen and just switch over to walking you through the dashboard. Okay, do you guys see the full page of the dashboard right now? I fully blew up the dashboard, so I can't see my little chat box to know if you guys are seeing it.
No, I'm not seeing the dashboard. Did you share your screen? You went to share, yeah, and your screen.
Share my screen. Oh, I know why. I have two monitors. Oh wait, just a second. I have two monitors, and I didn't know how this works with two monitors. I think my screen is on I chose the wrong one. Now can you see it?
No.
Where the heck? Sorry.
Terry, it's showing up for like a second, and then as soon as then it goes away. Are you seeing that? Like I've seen it twice when Melinda said, "Hey, do you see it?" and then it's gone.
Is it just a blue screen right now?
Yes,
yep.
It is just a blue screen.
That's what it's showing me right now, but that's not what it should be showing. I'm so sorry. Why is it not clicking over? Okay. Do you see it now?
That's your PowerPoint.
Okay. Now do you see it? Now it's showing. It's showing now?
Yes.
Okay. Does it show the full screen? Do I need to enlarge it?
Yes, please.
Okay. Okay. And now, can you see it well?
Yes.
Okay, thank you. So while we go through this today, we probably won't be able to see, we may only through small print be able to see the exact data that we're showing. So my purpose today is not to look at the individual data. You'll be able to explore that on your own, but just to show you how you can utilize it and what features it has. So don't worry if some of the text is small and you don't see everything, because you will have time to be able to do that. So when you open up the first page of the dashboard, you'll see a page that shows an intro, which is this page. There's a county profile function, which has data for a variety of indicators for each county. You will see what they call a risk construct view, and on that page, you'll be able to select specific indicators that you're interested in, and then you can click on the specific county that you want to look at to see the data for that county. The fourth page is a county comparison view, and this has an LME function in it as well, so you can select just the counties you want, or you could select to capture all the counties for that LME and compare them.
Look, I don't have it. I don't see it. Really, I don't see it.
If y'all can make sure that you mute your phones, because we are having a lot of background noise. And I apologize for any technology difficulties we're having, but we're working on this.
Can most people see it? It looks like it's showing up on my screen now, where when we were first starting, it just showed a blue screen.
I still could not see it.
Terry, what do you want me to do? I don't know if that's a common problem.
I'm working on it.
Okay. I'm going to go ahead and keep talking on this intro screen, and hopefully we'll have it resolved then. This doesn't have any data, it just has little icons to show the different options. The fifth page is a methodology page, so that shows where we got the data, how we measured it, how things were, how scores were given. It tells, so this is where the people who are most interested in really getting down to the raw data should look to have, this will help you get the greatest understanding of what each measure means. It's also a source. Sometimes you'll be able to get the local level data sooner than you can get the state level data. So it does have contact information for all that data. So it's possible that there's some things, if they're not on the dashboard yet, you might be able to go to your local source and be able to get it a little bit sooner. And then the final page, yeah.
If you will, sorry, not to pause you, but can we try, I'm going to try to share my screen and see if you can work off of mine.
Okay.
Okay.
That's fine. So you want me to unshare?
If you can see, well, I think I've got you.
I see it now.
Okay, so I can go ahead. You can navigate through me. Can everybody see my screen now? I'm on the risk construct view. Okay, it looks like people can see it. Melinda, can you see it?
I can see it. Yeah, let's do that. Can you go to the intro page? Okay, and so the final page in the dashboard is resources. And this is a page of different data sets that have measures related to substance use and their risk and protective factors that you could go to, most likely to get state or national level data, but it is another source where you can get information. And now, Terry, if we could go to the county profile view. So the county profile view, this is what it sounds like. It is a view where you can look at data for a specific county. So for example, if you were serving Buncombe County, you could go to the top portion, and Terry, if you could put your cursor right where it's showing, it's currently showing Alamance, you can select your county here. And in this view, you can select one county at a time. Right next to that county selector, you do see a year selector, and you can do that by a slider to change the years. Then if you, Terry, scroll a little bit down so we can see the demographics. So for every county, there is an indicator of demographics, so it has a youth and an adult population. When you look at that, you see an indicator, a goldish bar. That is representative of the average for North Carolina counties, so you can see if you're looking at a population that is bigger or smaller. And similarly, if we look at the race, we can see the bars show how that county compares to the state. So for Alamance County in 2014, they were, on average, had a higher white population. They were right at the state average for their Black population, had a higher Hispanic and Latino population as well. And other things were pretty similar to the state.
A question has been asked about how far the years, what's the data, like how far, what's the range?
It starts in 2010. Right now it's at 2015. 2016 data should be being added soon. And after that, the dates when administrative data varies. Usually at the earliest you can get administrative final data is in the middle of the year, so hopefully we'll be able to add the 2017 data in the fall. The 2016 data should be coming soon. Okay, and then if we scroll over to the left-hand side of the screen, Terry, you see, let's go up a little bit and stop at the risk scores. You see you can choose a risk construct category, and these are broad categories that you can select to reduce the array of variables you're looking at, or you could look at all of them. So academic risk indicators are things like a school graduation rate. I don't know if it's there yet, but it's going to be there. Academic scores. I believe there's some school suspension and expulsion data in there. But so there are several different categories of under risk constructs, and they all have multiple variables. And then, whoops, you got an email pop up, Terry. Right next to the risk construct category, there is also a way you can sort by the risk score or the rate. Oops, never mind, sorry. I'm thinking about jumping ahead to a different page. So there's different reasons you might want to know different things. If you sort by risk score, you're going to see the things that your county that you're looking at has the highest risk score down to the lowest risk risks. I don't know if you want to do that, Terry. So that would give you a glimpse of where your county is higher and lower. This is by the risk construct category, so these are clustered into categories. You can see there's variation. And there's still a few places where they're working to get the initial data sources. And it looks like Alamance County was low in their retail access to alcohol, lower than statewide average. And I don't know if you can scroll down to give a little bit more peek there. They have a higher percentage of, significantly higher percentage of people who are receiving substance abuse treatment. They're kind of ebb and flow on their family dynamics and other related consequence indicators, if they're more favorable or less favorable than the rest of the state. We're very convenient in North Carolina that we have 100 counties. You can see right after the risk indicator name, there is a county rank. So 81, for example, for the sexual assault clients per 1,000 persons, that is a higher risk than average in the state. So they have there are 18 counties that have higher sexual assault, higher number of sexual assault clients. Conversely, the percent of residential properties that are vacant, their risk is quite low. They have only 7 other counties in the state have lower rates of residential properties that are vacant. So you can look at the data in a number of ways, looking to see what your number, where you are from 1 to 100 in the state, and closer to 1 is more favorable, less risk. Closer to 100 is a higher risk. Okay. And Terry, if you scroll back up again, can you just show how that changes when you sort it by the risk score, please?
So a question has been asked if the data tracks non-traditional schools, private schools, charter schools, and things like that as well.
That would depend upon the specific indicator. I don't know the answer to that offhand, but the way we could find that out is actually to look in the methodology page under the academic risk constructs and then the specific variables. And it should tell us the data source, which should then also tell us if it includes the entire universe, solely private schools, solely public schools, solely charter schools, whatever the measure indicates. Most of the measures, I believe, are going to be based upon your public schools. But I would have to confirm that through the methodology page. Okay, Terry, scroll up a little bit and go over towards the map. So if you click on the map, it will show you the rate for the indicator that you have selected for every county. Which is always nice to see. The maps are shaded such that lighter colors are, again, lower risk, and darker colors are greater risk. And this indicator that's highlighted, and it would be highlighted on the left-hand side, is high school dropout rate. So it looks like our lowest risk counties are really across the state, and there is one much higher county in the north. I don't recognize Halifax County, has a much higher high school dropout rate than any of our other counties. But I know I particularly like looking at the maps, particularly in the risk construct page, which we'll preview next. But then if you scroll down to the bottom of the page, there is also an indicator that looks at how the state you've selected compares to the rest of the county, rest of the state. So in this case, you can see for high school dropout rate, Alamance County has a higher than state average in terms of high school dropout rate. It's changed similarly over time compared to the state. Okay. And Terry, if we go to the risk construct view. So this page looks similar, except for at the top, it will probably be helpful to narrow down the list just for looking at things. But the first thing that you're asked to do is to select a risk construct category. And it's ideal to do this for this page, and I'll show you why in a second. So. And then we should see something. Look at what's selected under the under the risk indicator. So yeah, check that all. On this one, RTI has recommended not looking at more than 3 things at a time because otherwise it's a little bit overwhelming to do so. And you can see this has all of the counties listed. You can also select the year just like you could in the county profile selector. I believe in this one you should be able to sort by the risk score as well. You can change this to show the rate or the risk scores. And the ones that are currently showing with a -3 to +3, those are the risk scores. And so this is basically taking the data and distributing it more evenly so you can show what county has the very greatest risk to the county with the very highest risk. And Terry, can you click on a county? Because initially, there's not a lot of variation in these measures. Can we change the category, Terry? The risk construct category. Maybe change it to alcohol and other drug-related consequences. And then click on the unintentional poisoning rate at the bottom, the smoking-related death rate, and the alcohol-related death rate about 1/3 of the way down. I think those all have information. They look more varied. Okay. So you can see there's lots of information in this, but it's kind of a lot. So if you select a county, so you could select a county on the map. So you can see now Terry clicked on the alcohol-related death rate in Rockingham County. So when she doesn't have a county selected, it shows the rates for every county for all three of those measures. And you can see when she's selecting Rockingham, again, the state line is the gold line, and the county line is blue. As you would expect, there's more variation from year to year in the counties, and the state's more stable. So, but it gives you a sense of where your county falls for multiple indicators.
And I apologize, it is auto switching back to all. I'm not touching it. So I just thought I would tell you that.
I need to ask RTI about that because I don't think it was doing that before. But this is useful. This is one of the things, so you can see like they're a little bit more varied, but you can see when you look at Surry County now, those three measures. The Surry County rate, the alcohol-related rate, death rate increased until 2014 where it went down. They're similar, their smoking death rate has been more stable, and their overdose rates, deaths, as you would expect, has been a little bit more unstable. But you can see these are all on a per, well, the first two, well, sorry, wait. The unintentional poisoning rate and the alcohol-related death rate, they are both per 100,000 people. The smoking-related death rate is per, wait, sorry. Sometimes these rates vary. I was misreading this sideways. But so you want to look at the rate. They're looking at different numbers. You can see in general the smoking-related death rate is much higher than the death rates for the other substances. The second highest, then unintentional poisoning rate, death rates are higher than alcohol-related death rates. And this data was influential in choosing our priorities. We know we are seeing great consequences from those substances. And so on this page, you want to narrow down your list of indicators you're looking at so you can look more meaningfully. If we go to the county comparison view, this is the easiest way, for example, for LMEs to see variations in their regimen, or providers who serve multiple counties to also see variation across their catchment area. So for this example, let's narrow this down to Alliance, and I'm choosing Alliance solely because they have the smallest number of counties, so it'll be most easiest to see what data we have. If you selected county right under the LME button, you could select those. You can also select just your county by leaving LMEs at all and then selecting the counties that you were interested in solely. It's a little easier to see if you do a smaller array of numbers than if you do all of them. You can, again, narrow down your pool of risk construct categories. and specific indicators. Right now, this defaulted to the adult HIV rate. Terry, if you scroll down a little bit. You can see in this particular instance, when we're looking at adult HIV rate, that Durham County has a higher rate than the others. Cumberland County is next in line, but Durham County is almost the highest rate in the state, where Johnston County is right at the statewide average, so that's easy to tell. And then you can also see that graphically on the map. And then if you scroll down to the adult HIV rate, the trend line tables, you can see again the state average is the gold line, and then each color, the color lines are associated with the tables. So Wake County is pink, right at the average. Johnston County is there's no bar for them, they must be the red because they're the lowest in the area. Then you can see Durham is the very highest, and Cumberland County is rather high in the state, but a fairly significant drop compared to Durham County. And again, these numbers are referenced to per 100,000 population. The counties with larger populations that you're looking at will tend to have more stable numbers, while smaller counties will have, will likely, for many indicators, have more variable lines because of small numbers. And in a small county, one incidence can make a big difference. Okay. Terry, do you want to scroll up and see how that view compares if you look at more than one indicator? Oh, no, never mind. Sorry, you can't select more than one. I apologize. Do you want to show, Terry, select Alliance off. Hit all. And then you should have the full drop down of counties. So if you were a provider, you could select all of your counties. So I don't know if you want to just hit a few to show up, but they'll all show. But if you want to look at the trend lines, it will be challenging to look at the trend lines if you have all 100 counties. And there is a fairly big data set behind this, so sometimes it does take a little bit of time to process a different view. So you can see, so the difference between the LME and the county selector, when you look at the, Terry, can you scroll up just a tiny bit? When you look at the LME view, only the counties within the LME will show up on the map. But when you look at the county selector, when you just select counties, for example, if you wanted to do them just for your provider catchment area, only the county selected would show up in the risk ratings, but they will all show up in the map. And I believe only the counties that you've selected should show up in the trend line. Is there any questions before we go over to the methodology? Okay. Terry, do you want to move over to the methodology page, please? So this tells a little bit about the data set and kind of how it was started and why it was started. It shows how the rates and percentages were calculated to make sure that all counties were treated similarly. It doesn't necessarily make sense always to look at raw numbers given differences in county size. 5 overdose deaths in Mecklenburg County is a lot different than 5 overdose deaths in Surry County, for example. So everything is translated to both a rate as well as a risk score. If you look at step 2, it talks about statistically how the risk scores were computed. I'm not going to go into that in detail. Those who are interested can look at that, but it's basically to weight things a little bit more evenly and ensure that the division from the very lowest risk county to the highest risk county are a little bit more even. 3 is the ranking, and that again, that's just the very lowest risk county to the highest risk county for each indicator. So it's quite convenient for grasping and understanding that we have 100 counties in North Carolina. This describes a little bit more the limitations of the data, which I'm going to talk about a little bit separately. But these are all administrative data, so we are limited to things that are routinely collected for all 100 counties. There are several indicators that have small n's, so they are less stable than other numbers. There is always a lag in when you get administrative data, this is still a growing database, so not everything that we would ideally want to see is here. We are going to give you a chance to share what you would like to ensure gets added, and we have a few things we definitely want to get added. There's a little bit more text on how you interpret the risk scores. And go ahead and scroll down. The most important thing is when you look at the bar charts, everything to the left of the center line is lower risk and everything to the right is higher risk, and the farther you are into that line, the greater or lower your risk is for that particular county. As it discusses here, this data, along with other data sources in your community, can be used to inform what strategies, what substances and strategies should be targeted in your community to most effectively utilize limited prevention dollars. Terry, do you want to scroll down a little bit more? And then probably most importantly for most who are curious about the data and where it came from is this link of the data sources. And so there's detailed information about the data source and where you can get the data. And again, as I mentioned, sometimes administrative data always lags at the state level. States do a lot of screening to ensure that the data is reliable, that it's fully updated, and that you'll get the highest quality measures. Sometimes you can get those final numbers earlier at your local county level. So this list tells you exactly what was measured, where the data set comes from, and where applicable, it shows you the link to that data set. So you can scroll down just a little bit more, Terry. So you select that for each indicator, and you will be able to find out more about that data. Most of the measures are fairly intuitive by their label, but they are not all. And again, someone asked the question about what is the populations for the school data? This section would be able to tell you that. Okay. Next, Terry, if you could scroll to the resource page, which is the final, should be the final tab. So this is pretty straightforward. It has resources that might be helpful. What scientists refer to as NSDUH, which is the National Survey on Drug Use and Health. A long time ago, it used to be the National Household Survey, people called it. Some people still do, but that is a national survey that is sponsored by SAMHSA. It asks detailed questions and provides state estimates as well as some sub-state estimates. SAMHSA's Behavioral Health Barometer takes data from a variety of different indicators and compiles them to show the picture of substance use across North Carolina. Again, that's a state-level resource. The Youth Risk Behavior is also a state-level resource. They are very close to putting out their 2017 data. The 2015 data is the data set that's currently available, but they're, as I said, they're very close to being able to release the North Carolina 2017 Youth Risk Behavior Survey. What people refer to as BRFIS, the Behavioral Risk Factor Surveillance System. This is a data set that's done by survey to people all across. It's done in every state, but specifically for North Carolina. It's an adult population. It asks about a variety of health indicators and behaviors. In recent years, it doesn't have a lot of substance use indicators, but I believe there's some tobacco measures and some alcohol measures. And again, that's with the adult population. North Carolina Department of Public Safety has data on crimes that are occurring in your communities. They do update that so that you can get data usually by county. It takes a little bit of digging in to find it. The Department of Health and Human Services Injury and Violence Prevention Branch is very active in data surveillance. If you are doing work on prescription drug and other opioid abuse and misuse, you should definitely sign up for Scott Crochet-Bellhold's data information. They're doing monthly reports on overdose data. It is for the whole state, and it's using what they refer to as provisional data, so it's not quite the final numbers, but they should be pretty good numbers to keep a very recent tab on what's happening with the opioid epidemic. So again, I highly encourage you to sign up for that. It also sends out a lot of different literature, but again, monthly, it has a data profile that public health does to do more recent tracking. It includes overdose deaths. It includes some demographics on those. It also has naloxone administration and reversals and a variety of other things. The Controlled Substance Reporting System is our North Carolina PDMP, and they have a website that is, it's been down for a little while, and it's why we have this dashboard at a temporary site right now. It is expected to be back online soon, but they have 2 pages in particular on the Controlled Substance Reporting System. One that you can't access at all right now, but you should be able to request data on. It's looking at what's specifically being prescribed by counties, It has overall number of prescriptions, number of opioid prescriptions, high MME opioid prescriptions, which those are ones that are at a dosage level known to be potentially dangerous. And then I believe it also had benzos. That page is not currently active, but it is expected to come back online. The page that you can still get some information, although it hasn't been updated for quite some time, but the CSRS is interested in sharing this data. It's just going through some IT and data security, resolving some questions about that. But the page that you can see currently by month is to look at how many people in your area are using the system. And they look at it by overall numbers of users, by prescribers, dispensers, and then what they refer to as delegates. And delegates are, for example, your nursing staff who might run a report for a doctor. What it doesn't yet have is what the potential base is, but it does compute the queries relative to the number of people who are prescribing. So it should be capturing your active prescribers. So if you're in, for example, an area that has an academic medical center where you might have people doing a lot of physicians and similar doing research but not actively seeing patients, they would not end up being captured in that. So it captures your active prescribers. And then the National Forensic Laboratory Information System, which people refer to as NFILIS, and this is drug arrest data. So there's a variety of sources that you can go to in addition to the dashboard that help to paint a bigger picture of what's happening in your community. And then I also wanted to share, Terry, if we go back to the county profiles page, that would be great. Actually, we can go actually for the PowerPoint. Will probably be easier. And scroll down to demographics. It's going to be, let's see.
You can actually control the PowerPoint on the screen, Melissa.
Okay.
And I think there are potentially 2 questions. It looks like Jennifer and Mark might have had a question.
Okay.
Hold on, let's make sure.
Let me just get to where I want to go.
Sure.
I see a question from Janet asking how can we gain access to NC support. I have the website for it at the end of the slides, so you'll be able to have those. And the only other question I see is the question about how far the data goes back, which we already answered. Am I missing something?
There's a couple of questions that have come into me. One is there's a question about do they have to purchase software?
No, this is on the web.
For
so you just go to it like you'd go to any other website.
Okay. Well, you won't be able to download the data into a file unless you have Tableau.
Yeah, you cannot currently download the data. That is something we're interested in. I don't know if it's going to be possible given what Tableau can and cannot do. We're using a version of Tableau called Tableau Public, which is a great resource, but it does have a few little quirky things that limit what we can do. but I'm going to make a note to ask again about that.
The other question is in the risk construct view, is the county rank, if the county rank shows no data, who's responsible for reporting the data?
I believe that's still in the methodology page where it can be. It is something that should end up being added as one of the slides I'm going to talk about soon. This is still, while we're farther along, this is still definitely a work in progress. Not everything is here that we want to be here. But if there's something that you see currently missing, it should, and that is on the list, there should be information about how to get it in the methodology page. But also definitely shoot me a message about data that you're particularly wanting, because I can use that with the contractor to say, this is something we really need to prioritize getting onto the dashboard. And I'm very serious about that. So we saw at the very beginning, we do have demographics in there for every county. It shows the youth population and the adult population, and then this standard federally reportable breakdowns for race and ethnicity. Just broadly, again, there's multiple categories under all of these, but the current risk construct categories are alcohol and other drug-related consequences, other related consequences, which are still consequences that are associated with substance use, but maybe not quite as directly, problems indirectly associated with substance use, like homelessness or mental health indicators, crime and violence stats, things related to alcohol availability. We have been working to explore what we can get in terms of tobacco. We are trying, there's not the same kind of data available for tobacco sales as there is for alcohol sales, but we are trying to see if we can get compliance data up from FDA compliance checks as well as past SINAR surveys. That's a little bit challenging because not every county is captured every year. So we're working on it, how we can do that, but it's something that we want to be adding. And there's measures about poverty and socioeconomic deprivation, academic risk, community stability. So that would be how much people are moving, how many housing units are unoccupied and things like that, and then just other general contextual variables. So this is a good question for you. We know there's some things missing. Some of the things that we want to get included, again, I mentioned we're trying to get some tobacco data up there. The only thing that's currently there for tobacco right now is tobacco-related deaths. There are a lot more challenges getting tobacco measures than there are other measures, mostly because they're not collected consistently for every county. And with tobacco versus alcohol, there's not licensing requirements, so there's not the same tracking of sales as there is with alcohol. And then overdoses, there is currently an indicator for overdoses, but there's a lot more that's being routinely collected, such as looking at overdoses from prescription drugs versus illicit opioids such as heroin or illicitly manufactured fentanyl, as well as whether overdoses were intentional or unintentional due to suicide. Things like the suicide numbers might suicide overdoses, sorry. The numbers might be too small to be able to do statewide, but there's definitely some additional indicators. There's also the possibility of being able to add indicators related to naloxone reversals, and then also CSRS utilization. When the first when the last EPI profile before this was done in 2012, the only thing that you could get out of the CSRS was whether a provider was registered. It didn't matter whether they were utilizing the system. That was all you could get, that they were registered for the system. And as you might guess, there's a big difference between being registered for the system and utilizing it. So that's a much more meaningful metric. And now, in addition to prescribing, in addition to utilization, we can also get some data on prescribing for each county, which is very, very useful to you, and that should be coming up soon. I know that data, RTI has that data, and it's supposed to be being added. So, kind of seeing what we've scrolled through, what data are you interested in that you don't see that your understanding is that it is something we can get for all 100 counties? Marijuana trends. I don't know of any data source offhand that shows marijuana usage by county, and I don't know if perhaps someone else knows if any of our law enforcement data might show marijuana-related arrests. Where we're most likely to be able to capture information about use is within our survey data, like the YRBS, our youth prevention survey, which doesn't have data, neither of which have data down to the county level. Yes, Mark indicated that the arrest rates are missing, and that is something that is on the list to be added. I believe they have not been added at all. Mark indicated they're missing for all 7 of their counties, and I believe that's going to be true across the state, and it is on the list of things that need to be updated. Anything else that comes to people's mind? I encourage you, when we're done, to take a look and see if there's things that you do think that you can get at the county level that might be worth asking about. It's possible there's things like the arrest data which are on the list to be added, but it's possible there's things that we did not capture at all, and we would really appreciate hearing from you on those things. Okay, I'm going to move on to the next page, but again, encourage you to keep thinking about that. So I mentioned most of these.
Just to clarify, because there's a question, if people do have Tableau, then when they download the file at the top of the screen, there's a right-hand screen where you can download data. If you have Tableau, you should be able to download it, correct?
I would have to confirm. I don't know the answer to that.
Okay, because I know that in the past it was saying it was available for downloading from the right hand, like it gave you the option to download all the data, but you had to have Tableau. So I wanted to clarify because that was a question, and from my understanding, if you had Tableau, you should be able to download, but I wanted just to check with you.
Yeah, I don't know. I will have to follow up on that. I've made a note for myself. I'm guessing most providers don't have Tableau. So, but I will look into that.
Some of the LMEs may have access, so I just wanted to check about that.
Okay, I will check into it. I don't know the answer offhand. So I've mentioned most of the limitations for this data. The first one is fairly significant. There is always going to be a lag in the data when you're looking at administrative data, particularly for the entire state. Again, sometimes you can get your local data a little earlier than we can get data for the whole state. So it is worth checking into that for your sources that you're most interested in. And so it's really important to nurture those relationships with your local data holders to develop relationships where they'll share those things. Many of them are routinely tracking that and will, with assurances about how you're going to use it, will often share it. Not always, but again, building those relationships is really helpful if you want to try to get access to things a little earlier. Then a big challenge is things for small ends, and there's two problems with that. One thing is that there's really, when your numbers are really small, you see extreme variations. One event can make your curve look entirely different. So, for example, if you wanted to look at youth overdose deaths, those numbers are going to be really small for most of the state, for all but our biggest counties. So those numbers are going to vary a lot, and even just one or two could make things look dramatically different than they had. So that's a challenge. And then sometimes there's some data sources will allow you to share small n data, and others, particularly when it's really sensitive data such as HIV, they will not allow you to share if you have, for example, less than 10 cases in a county. So there's some data that you'll see where there's data for some counties but not others. That's likely the case where it's something that there is concern about the confidentiality of participants if you share small n events. And then again, this dashboard is still being built. We know it does not have everything, and we know we need to get the next year of data, the 2016 data up. It's going to be several more months before the 2017 data is available, but it's still being developed. So that's right now a limitation. So Patty had asked if there's a way to look at the projected cost to the county for the different risk factors. I don't know offhand that question. My guess is that would be a very, very big project, and that it probably wouldn't be feasible for most of the indicators. There might be a few where it would be possible to project how much it costs. But that would probably only be related to the deaths associated with those substances, and even that would be complicated. But it's something to consider, not for in the immediate, but maybe in the future. And then I see Mark's questions about if we can download the data, could it be exported into Excel, which is much more accessible to folks than Tableau. I will ask that. That's going to be one of those things where it is what it is kind of answer because of the limitations of Tableau Public. It's very powerful in that we can do a lot, but it does definitely have some limitations, and it costs a lot more money to use the non-public version of Tableau. It's not financially feasible. Okay, so an important point to talk about is we mentioned that several things are coming. One of those I mentioned already is the data sources that are missing. There are several things on the list that are going to be added. As I said, there is definitely going to be more data from the CSRS, more overdose data. We're trying to find some tobacco indicators. We do not at all have that solidified, but we're working on it. There are the data that there's a placeholder for, but the data is not there, so those are obviously going to be added. we are working on adding a similar county selector. So instead of you choosing who you think might be a county that's similar to you, that can be done data-wise. And Public Health Center for Health Statistics has developed the module for this, and RTI is working to incorporate that into the dashboard so that when you look at your county who has a demographic profile similar to yours, you can select other counties that are similar to see how you can compare. One of the things, as an interesting side note, I just recently for the Partnership for Success project got a list of comparison communities, which are comparison communities are primarily rural, though they're almost all rural or at best suburban. They're largely in the mountains. There's not a single metropolitan community. And when I got the example similar county comparisons, we had our 3 largest metropolitan counties on it. And so I said, this doesn't really work. They have a lot different trends. So I think you guys, and I was allowed to select better comparison counties. But I think you will find that that's potentially useful to look at that similar county selector when it's added. And then we are also working on adding similar pages to the county profile, the risk construct view, and the comparison page for LME MCOs. So that data would be aggregated up. It will be especially helpful for the low-end events in small communities. So there are, as you guys know, we have a lot of very small rural communities in our state, and within those communities, there's often going to be data that you can't get at the county level because the events are too infrequent. So if we can aggregate up to the LME MCO level, that will help resolve some of that missing data. It'll also, of course, be useful for LME MCOs as they help to identify for the entire catchment area the gaps in services. So those are things that are in the works. If there are other things that are of interest to you to see if we might be able to add those, we'd definitely like to hear your suggestions. As I mentioned, the database is still evolving, but several things have changed based upon feedback from people like yourself. So if you have something right now, you're welcome to share it. But if not, think about it and get back to me to let me know things that you would like to see coming up in the future for the dashboard. Okay, I'm going to leave that question up here. Oh, this is probably the most important thing. So right now it's in a temporary location. There are some questions around IT that are being resolved. It will eventually go onto the state prevention website. And so the dashboard is at http://tinyurl.com/NC Support Data Dashboard. If when you look at that, it doesn't show up under the light green background, click on the options under Marsha Cross's name, and you'll see different indicators, and look for the light green background, and that will be the most recent version. Does everybody have that? Oh, Insight has put the link in the chat box. Thank you, Terry. And questions, or also I'll take suggestions for features that providers would be interested in. And we've tried to provide a cross-section of ways that you can look at the data, because we know we all have different needs and purposes, and sometimes what we need right now is different than what we're going to need to resolve a different question that we have in our community. And so we've tried to make it so the dashboard could serve multiple purposes. Again, be interactive and be dynamic rather than static, and being able to be updated. And while it's still coming along, we are really happy that we've been able to develop this resource. And while we were not sure how we were going to do it in the future, we now do have funds earmarked to be able to keep developing this dashboard when the contract that is paid for through PFS, which is ending in September. When that contract ends, we do have a mechanism to be able to keep the dashboard up, which I'm very, very happy about. I was really worried about that as we were developing it. Okay, questions?
Thank you for all the hard work.
Thank you, Jennifer.
Currently apparently the link is not working.
Let me see. Try this. Try the link I just popped up. Terry, if they're having trouble with that, you could, yeah, I thought that should get you there. You could also capture the link with the much longer Tableau name.
And I did put that in the chat box earlier.
Okay.
There was a first link as well that works that I sent out that has the longer Tableau name.
Yeah, and that will be the one that will get you to the green background on first click. Any questions? Well, I want to thank you guys all for participating today. And again, I encourage you to go up and look at the list of risk indicators. And if there's things that you see, not the ones that don't show data right now, because those are definitely on the list, but if there's things that you know are available that are not showing up in the list at all, please email those to me. And I will look into getting those added. And again, also think about if there's additional utilities beyond those I mentioned that would be useful, please also feel free to email those as well.
And before everyone jumps off, I do want to remind everyone that if you are sharing a computer, you need to send a name and an email address of the individuals who are sharing. But also, just as a reminder, we're working with all the LME MCOs to develop dates for the webinars that will be coming up at the end of February, beginning of March, where we will be doing a TA webinar with the LMEs and the providers, specifically around the planning prioritization worksheets and looking at the data, making sure that you're prioritizing and you're finding those intervening variables, and that you're progressing towards your choosing the right interventions for fiscal year 19. And we're also working with the LME MCOs to develop face-to-face dates for the TA that will be about action planning and the ECHO transition for the fiscal year 19 interventions, and that will be in either May or June. So just be on the lookout for your MCO emails where they'll be sending out dates for you guys. And also, if you have any questions related to the action planning as we move forward, please don't hesitate to reach out to us at the TTA Center. Otherwise, I'll be sending out an email as well with a link to an evaluation. If you all will please complete that for us, that'll be great. We have to have evaluations for our certification hours now. So something new the board has put in place. So if you'll take a minute to do that, that would be really appreciated. And Melinda also put in the chat box her new email address.
Yes, I still have access to both. I have access to both emails, but that will be my email going forward. So if you have those suggestions, email my wakehealth.edu address.